Oh hi, didn't see you there. I'm Leah Hurley, one of the co-founders of PAP, also known as the People Against Progeria. Alongside my co-founder, JC Dombrowski, our organization has been working to inform parents that have children affected by progeria about the effects on their child, trying to slow down the process of progeria, and eventually find a treatment. But that all starts with you. When you first think of a child, what's your thoughts? Healthiness, agility and energy that lasts for days, youthfulness? Well, children affected by progeria won't be able to be affiliated with any of these adjectives. Did you know that only 1 in 4 million people are affected by progeria, and that there's less than 1,000 cases known today? But did you also know that by the time a child that's affected by progeria is 8, 9, or 10, they could already be suffering from diseases like osteoporosis and cardiovascular disease? Did you also know that a child with progeria is lucky to live to the age of 13 and even luckier to live to the age of 22? How could a disease that affects so little be so drastic and have such drastic measures on a child? We need your help to fix this. Now, before you go pulling out your wallet, let's explain to you what progeria is and how you can help us find a treatment for this genetic disorder.
There was a time I was alone, nowhere to go and no place to call home. My only friend was the man in the moon, and even sometimes he would go away too. And one night as I closed my eyes, I saw a shadow flying high.
Now here is an excerpt from the TV show The X-Files. Though some of the information is old, it gives you a clear representation of the effects of progeria on a child.
The patient you see is an 8-year-old girl suffering from the advanced stages of progeria.
She looks about 90.
Only about 100 cases have ever been reported, so the disease is rare.
But fatal.
Some progeria patients make it to early adulthood, but others become terminal at age 7 or 8.
What's the cause of death?
Clinically, it's cardiac or cerebrovascular disease, but actually, these poor kids die of old age.
Well, how exactly is progeria diagnosed, you may ask? Well, geneticists use the recognition of common clinical features as well as the detection of C1824CT, or a heterozygous LMNA, pathogenic variant. The pathogenic variant's transition in exon 11 results in a silent glide-to-glide change at codon 608. This silent change causes the deletion of 150 nucleotides and 50 amino acids from the lamin A protein. Lamin A is post-transitionally modified with the addition of a farnesyl group at the C-terminus that seems to assist in coating the protein to the inner surface of the nuclear membrane. The protein then needs to be released from this tether, which is accomplished by an enzyme called ZMP-STE24. The abnormal splice event that causes progeria eliminates the ZMP-STE24 enzyme cleavage. Therefore, the protein is permanently farnesylated.
He came to me with the sweetest smile, told me he wanted to talk for a while. He said, Peter Pan, that's what they call me. I promise that you'll never be lonely. Ever since that day, I am a lost boy from Neverland, usually hanging out with Peter Pan. And when we're bored, we play in the woods, always on the run from Captain Hook.
So now you might be asking yourself, what exactly is progeria? Formerly known as Hutchinson-Gilford progeria syndrome, the disorder has had a direct correlation to the lamin A gene. The lamin A gene produces lamin A protein, which in essence is a structural holding of the cell's nucleus. Defective lamin A proteins do not produce enough proteins and cause cellular instability and even premature cell death. The defective lamin A protein can cause an unstable nuclear envelope, which directly damages the cell's nucleus. And this is what causes the rapid aging of children affected by the genetic disorder progeria. And almost all the individuals affected by progeria have the disorder as a result of a de novo autosomal dominant pathogenic variant. Typically, the conditions affiliated with progeria would affect an older group of people. But progeria does cause rapid aging and early teen death. There is no cure, there is only treatment. With your help, the geneticists at People Against Progeria have been able to isolate the progeria gene, but we need your donations and your support to help us find out how to cure this disorder.
Lost boy, they say to me, away from all of reality. Neverland's home to lost boys like me, and lost boys like me are free. He sprinkled me in pixie dust and told me to believe in him and believe.
Progeria is an opportunistic disease. It doesn't affect one gender or race over the other. Its new mutations of the LMNA gene is what cause progeria, and it occurs mostly in families that have had no history of the disease beforehand. Progeria is autosomal dominant, meaning that only one copy of the gene is sufficient enough to cause a child to be affected by progeria. There is a late form of progeria known as Werner syndrome and can be affecting a person by their late teens. The life expectancy is 30 to 40 years. Though there is no cure for progeria, medications can be prescribed to slow down the process. Some medications include pravastatin, stimvastatin, and atorvastatin. Other treatment procedures include zoldermic, acid by injection, therapies including occupational and physical, and another common procedure is dental extractions. Sadly, people affected by progeria may not be mobile and athletic like other children their age due to muscle and bone denigration and cardiovascular and respiratory issues. The symptoms of progeria are painful and mostly affect older people. Some symptoms include slowed growth, below average height and weight, narrowed face, small lower jaw, thin lips, head disproportional to face, beaked nose, prominent eyes, incomplete closure of eyelids, loss of hair, both eyebrows and eyelashes, visible veins, thinning, spotty, and wrinkled skin, and also a high-pitched voice. Other symptoms of the disorder include hardening and tightening of the trunk and other extremities, delayed and abnormal tooth formation, hearing loss, loss of fat under skin and loss of muscle mass, stiff joints, fragile bones, hip dysplasia, insulin resistance, and severe cardiovascular disease. We are proud to say here at PAP that our first clinical trial of progeria patients proved to be very successful. Doctors at our organization used lorlatinib, a farnesyltransferase inhibitor normally used in cancer treatments, to effectively help progeria patients in 4 categories: gaining weight, hearing, flexibility, and bone structure. Now it's your turn. We need your help to continue fighting against progeria.
In a cloud of green to your beautiful destiny. As we soared above the town that never loved me, I realized I finally had a family. Soon enough we reached never.